is a new gown. So normally we would roll it if we were reusing it. Here they're strict about, since we're OSU, we're state college, and they stick with like the human hospital rules for some stuff. So gowns being one of them, we throw them out every time. Plus we have students in our rotation, so every 2 weeks we get new vet students that are scrubbing in, and I think they just feel more comfortable if we use a new gown so they're not sharing and stuff. So so yeah, so normally we would have, in a typical GP, my previous practice, we would reuse these and use peroxide to get any blood out and lint roll them. So in this case, I don't need a lint roller because it's brand new, but we're gonna rewrap it anyway. So you're gonna have it facing, so this right now is facing, the front is facing you, the camera. So we're gonna put that down on our counter. So front is facing the camera. And then this is the interior. So we don't want that to be what, we want them to touch the inside first. So what we're gonna do is kind of turn that shoulder seam out and fold it so that it looks like, we're gonna keep the sleeves right side out. Fold this so that it looks like kind of a vest. So we have still the inside facing us. Then what we're gonna do, because ultimately we want them to pick it up at this shoulder, so that, and it'll fall from accordion style facing away from them so that they can put their arms through the sleeves. So what we'll do is you can fold it in half this way, or you can start it with the other way up, and then we're gonna fold it in a quarter, pull it back. Same deal on this side. Make sure your sleeves are tucked in, but not so tight that they're gonna be hard to get undone. It's a little tangled. There we go. Okay, so sleeves are here. This is the front of the gown now. We've got our little friend hanging out there. So now we're going to fold in. Fold in. Get the sleeve in there. Okay. So we have this nice long like rectangle, and then if we flipped it over, then this is the inside, the front of the inside. So we're going to accordion fold. Some clinics do this differently, but it just kind of depends on your doctor preference too. So actually we started this backwards, so we're gonna go the other way. So we want the front of the inside, so the inside collar to be on top, because when they pick it up, then it'll fall away from them and they can put their arms through the sleeves. So we're gonna, so it's better to start what we've learned now. This is better to start from the top, and then you can get that perfect accordion with your gown facing the right way. There we go. Okay, so then the finished product should look like this on this side, this on this side, like that. And then what we're gonna do is we've got our inner wrap here. And we're gonna set our gown down. And then on top, we've got our little blue check towel. So we're gonna fold this in a similar way too. So they wanna be able to pick it up and dry one hand and then move to the other one. So typically what we'll do is we'll also fold this accordion style. So I'm trying to think what the best, yeah, yep, that's right. I'm gonna fold it this way. So it'll look like this. And then we're gonna fold a corner so that when they pick it up, they can grab that corner and everything else will fall away. Some places use paper towels. My last clinic would use paper towels. We use these chuck towels just because it saves energy and it's not disposable and less waste. So now what we're doing is we're gonna wrap our inside wrap. So we fold our one corner down, up, and then fold the triangle down so that you have that tab. And then I like to do like a little pleat almost here so that you can get a nice and tight, clean wrap. So then what we're gonna do is we're gonna come over, hold our little tab. Same thing on this one. Hold our tab. Then we're gonna turn around. It kind of looks like an envelope. Same thing, I kind of tuck in those edges a little bit, get it nice and neat. Pull this nice and tight. When you fold this in, you fold in only the closest to the actual pocket. So you should have a tab and it'll look like a little envelope. Now, we're gonna take our outer wrap and same deal as before. We are going to take this, and what we're actually gonna do is we're going to flip it over and we're gonna put it this way down. So the nice thing about having it flipped over, some places don't, and like I didn't learn that, but the nice thing about doing that is that if you're not sterile, you're opening up the non-sterile outer wrap, you're less inclined to touch this if it's not open towards you. So, and if it opens up, you're not gonna accidentally touch something that you shouldn't. Same deal, this wrap is a little bit bigger, so sometimes you have to kind of do a secondary fold to make it nice and neat, but we still want to keep that tail out. And then I also still do the pleat on this guy, just keeps it neat. And here, since we use the disposable gowns, they come pre-sterilized in packaging that's already autoclaved, so we don't have to worry about wrapping these kind of things. The only thing we really wrap here are our surgery packs and our instruments and stuff, dental instruments and stuff. So gowns, gloves, that kind of thing is not really a thing that we do here, but I know many practices that will do them. Now for this one, because this is so long, I do kind of an accordion thing, but I use my finger. So I have my middle finger underneath, index finger on top, and just kind of tuck in a small amount each time, and you still leave that little tab so you can pull it and it'll come right out. Then what we're gonna do is move over here, and we are going to take our indicator tape. We also forgot our indicator strip, so we're gonna unwrap this real quick. We're gonna just stick a quick strip in there. And you want it in the middle. So we can put it underneath this towel, but between the gown and the towel. I'll just rewrap this real fast. There we go. Okay. And that is an important part you don't want to forget. Because what'll happen is the nice thing about them is when they're in surgery, if they don't see an indicator strip, they can say, well, I don't know that that is a sterile pack, so we're not gonna use it because we don't have our strip saying, hey, this is sterile. So we don't feel comfortable with it, which is the whole point of that strip. So if you don't have it, then it makes sense not to use it. You have no proof that that pack is sterile. So do this quickly. Not as pretty as it was, but that's okay. So yeah, that's that sterile strip. Especially on your surgery packs, you don't want it touching metal instruments just because it can alter the results of the strip. And honestly, say that it's sterile and it's not, or vice versa, maybe not, maybe get too hot and then malfunction, won't work. So now we're gonna take this strip of tape. I don't like to put it on the tab because it makes it really hard to get a hold of that tab without having the tape. And then we're gonna tab our tape to make it easier to pull off, especially on these disposable pack wraps. It can be really hard. Keep it nice and tight. Nice little gown pack. We're going to use a Sharpie and write, this is our extra large gown pack with hug towel. Today's date, expiration date, which guidelines for surgery packs are 6 months, and for disposable pack like wraps or envelopes, excuse me, like these are a year. So that would put us in March 3/27, 24. Or 25, excuse me. So technically that's not exactly 6 months, but usually what we'll do is if it gets close, we check every month, and if it's close to that, we'll just rewrap them. So it should look like this. Legible initials should be on, date, expiration date, name of pack, and you can do like a color description if it's like a surgery pack. So that's it for our gown pack. Hi. Today we're wrapping a dog surgery pack. We have dog and cat surgery packs here. Mostly the difference is just going to be your forceps size. So let's get into it. Our dog packs include 6 huck towels. So we've got 4 on the bottom here. And then 4 carmelts, which look like little, some people say racetracks. I say they look like kind of like the horse loading tracks for racehorses. And then 2 peen forceps, which are ridged all the way up and all curved. Then we have our Oshner's, which in this pack we have, there's our peen, we have a straight and a curved. And the Oshner's, the difference between them and the peens, you know, the Oshner's have the teeth all the way up, but they also have these teeth on the end, kind of like rat teeth. And so we have a curved and a straight in here. Then we have our mosquitoes, which we have 4 curved mosquitoes, so end is curved, and 2 straights. These guys are teethed all the way down, and they just have the little tiny tip on the end. That's why they're called mosquitoes. So I like to take these guys, and everybody's different. The artistically, I feel like there's a component with these packs, but additionally, as long as everything is there together, visual and organized, each place and person probably has a method to their madness. So then what we're gonna do is we're gonna take our, let's move you. All right, these are our Mayo scissors. They're curved. So those guys I like to lay on the bottom. And then our Metzen bombs, which are long and curved and skinnier on the end, I like to loop those through. So it keeps everybody together and organized, nice and neat. Then, so it's easier for the clinician to see all of the instruments laid out, and they can visualize what they have in front of them. Next, we'll do forceps. So we have our Ranadson, which is teethed all the way down. They look like alligator teeth. And then our rat tooth, which these are a 2x1, so they have 2 teeth on the top, 1 on the bottom, and they're really fine and little. So we'll put those guys in there, and our towel clamps. So we have currently, I believe, 8 in this pack, and the reason being is because we use them on our underneath the towels on the underside of the first drape, and then the sterile drape over top too. So somebody hooked these guys together weird. So I like to hook these guys together a little bit differently. So let's get this guy wiped off real quick, since it did drop on the floor. They've already all been through the ultrasonic cleaner and everything and scrubbed, so we'll just wipe that off with some sterile spray and stuff. Well, not sterile spray, but instrument cleaner. Okay, so now what we're gonna do is, these are the only instruments that we're gonna lock in here. So I lock one, and then I lock the other facing each other. And these ones are penetrating towel clamps. So some of them that have like the balls on the end are non-penetrating. So I like to keep 4 together, just because otherwise it gets a little messy if they're all connected to each other. And then these 4. There we go. And so you have the 1 facing the one direction, and then 3 will be hooked through that one, linked through, and locked and facing towards it. So it should look like that. I like to tuck those guys in, and they can just go in wherever. So now, oops, stay. So now our package should look like this. So next, what we're gonna do is we're gonna get our sterile 4x4s. These ones are radiopaque, so that blue strip, we leave one in the body, it's gonna show up on x-ray. We put 10 in our packs, so I split them in 5 and 5. Just put them on there. We're gonna put our indicator strip. I like to tuck it right between those 4x4s, just so that way we're not up against the instruments. We're kind of in the middle of the pack, so it'll be able to read more accurately. Next, I leave my sharp scissors, my needle drivers, and scalpel holder on top. So it'll look like this. And then we're gonna put our other 2 huck towels on top. And I kind of like stagger them a little bit, just so that we're covering all of those instruments, so that nothing pokes through the wrap. So then we're gonna do that outer wrap. So fold towards, oops. And we want that tail. So these are big wraps, so we like to have them double folded if we need to, just to make sure we have that tail without covering it up. Pleat the side. We do this side as well. Same deal, tail sticking out. We need that tail. Can't really see me, but fold it over, our tail. Okay, now, same as our gown pack, this excess, we're gonna do a little accordion, keep that tail out, and flip her over. I'm a little bit of a perfectionist with these, so I like them to look nice and neat. I think it just looks nice on the shelf, and then also I feel like the surgeons appreciate having a nice, neat pack and knowing where their instruments are, and it's appealing, it looks nice, so. Okay. Pull it nice and tight. I had someone teach me that if you couldn't throw it against a wall and it stayed together, then it wasn't tight enough. So I don't know how true that actually is, but it's nice to keep them nice and neat. Now we're gonna move over here. We have our pack wrapped nice and neat. So you can kind of see those tails poking out. This is our initial tail. So what we're gonna do is take our tape. I like to leave it off of this tail, make it easier to pull tower tape. Tape that bad boy in. Get our Sharpie, which I've misplaced already. And this is our canine pack. And I believe it was red green. 9/27/24, expires 3/27/25. It's about 6 months, but okay. There is our surgery pack. Name, color. Some places do color. We don't very often, mostly just because all of our canine packs are the same, our optho packs are the same, cat packs are the same. Date of pack, date of expiration, and initials. And then we'll pop this guy in the autoclave. These green strips will turn black when it is sterile, and then that indicator strip on the inside is going to change color too. So that's our surgery pack. So this is for a drape pack, and normally we here, since we're OSU, we usually use drapes that are pre-packaged. So they come in like a pouch like this, just because we try to keep the same standards as like the human hospital. So like this guy, when you open it up, it has an outer wrap and it's like this. And then when the surgeon opens it, they open this way, this way. And then that way they can fold it out and then pull it down so that they're not contaminating the field and they're keeping it sterile. So what we're gonna do is we're gonna cut it in half, because sometimes we don't need this big drape, we only need half of it. So we're gonna cut it in half and wrap that. But so the drape, you know, same with some of our other things that we wrap, like the towels and the gowns, like we're gonna do our accordion style so that you're able to unfold it in a way that keeps it sterile. So technically this is already folded, but we're gonna go back to old school and do it the way that we would if we were cutting our own drapes, because a lot of times clinics will do it on a roll and they'll cut their own. We used to do this at my last clinic, cut the drapes, and we always just use the counter and we're like, all right, this is how long we want it. So same kind of deal. So we're gonna fold this guy. It's gonna be accordion. So it's kind of hard to do it on my own without this pleated, but you get the picture. And then what you're gonna do is down the middle, which 2, 3, Here we go. So it'll look like this. And then we're gonna fold it so that our open sides, so this is accordion this way, this is accordion this way, because then what we wanna do is we wanna be able to open it that way. So now what we're gonna do is we're gonna fold them. Same thing. And honestly, when you look at it, the whole thing is accordion. So it all follows the same pattern. And then they can split it in the middle. And then what we're gonna do is we are going to, excuse me, we're gonna accordion this. So that same thing, they can pick it up and it'll split right open for them. So now that we've got that drape wrapped, folded, now we're going to wrap it. So take our outer wraps, or inner wraps, excuse me, put our drape in, indicator strip just under one of those flaps so that it falls out and they can see it's sterile. And we're gonna fold this guy up nice and neat. A lot of times we'll include the drapes in our packs if we end up using them. Otherwise, they just open them straight from that pouch from the pre-sterilization when they come in. At my old clinic, they would just include them in the pack. Or sometimes we would include it in the gown pack for the surgeon, depending on their preference, because each surgeon is different. So doing the same thing we do with the other packs, we're, leaving our tabs, folding in accordion style on this end, and then we're gonna tape it. Tab your tape. And then we're going to Sharpie it. This is a half drape. It is 10/1. It expires 6 months. So technically these packs are, depending on what your guidelines you're looking at. So the surgery board guidelines say that a pack like this, like a pre-sealed pack, is good for a year. These are good for 6 months. I know in school we learned that these are only good for 2 weeks. So it just kind of depends on your practice preference, and then also your local, for us, it's the Ohio Veterinary Medical Association, so the OVMA, and they have separate guidelines. And then even like the surgery councils and stuff all have guidelines. Some of the surgeons have preferences. So it's good to just check all of those areas. So we are going to put expiration for 1/25. So the other thing too is, are we going to use this before that expiration date? Usually we try and expire them out sooner than we actually would technically expire it. So we might go through and see that everything in February is expiring out, February, March, April, and just change everything over and re-wrap them. So it just kind of depends. Hospital preference and then policy and stuff changes. So yep, that's a surgical drape pack. Yeah, and then it'll just go in the autoclave. So actually we can do that too. So this is our lovely autoclave. So this guy actually has pouches in it already that have been sterilized. Yes. So we can take those guys out and then load up our other stuff. So those are cooled So now what we're gonna do is we're gonna put this guy in here. We don't want things touching, so we like to keep them nice and separate. So we only need this guy in here right now. We've got other packs to go. Let's see if this one is already run. Yeah, it's run. So for this, I'm not gonna run it with just this in there because it's a waste, but if we are to run it, one, we need to make sure that the water is filled in this green area. If it gets down to the red, it can actually cause a fire just because there's not enough moisture for it to be able to heat up and steam, because this is a steam autoclave. And so the other thing too is you're not getting sterile instruments. So we definitely want that to stay high or up in the green. And we fill it here with like distilled water. The gasket here, actually, I think this one needs replaced. So when you're doing a cleaning, you'll just take this guy off. This comes out as well. We'll do a full cleaning. We'll pull the drawers out, run a clean cycle. When you're loading it, you're gonna lift this button up and then push it down. And then we're gonna hit the pack setting for packs, pouches for if there's just pouches. If there's a mixture of the two, I like to hit the packs because you're ensuring that you're getting all the way through and it's not gonna over sterilize the pouches. Hand pieces, same deal. You know, hand pieces and pouches are pretty similar in setting wise, and then I'll put them under packs if there's packs in there. We don't really have instruments that are unwrapped that we sterilize here, but yeah, there's that setting as well. And then you'll hit start and it'll beep and it'll let you know, hey, I'm getting ready to start, and then you won't be able to open this. So once it is drying and it's on the dry cycle, it will pop that door open, but it's really, really hot and there's a lot of steam, so we try not to touch it until it has completed the drying process. So that's our lovely autoclave. We've got 2 of them, so they're nice to have on hand for sure. And then like this guy needs its maintenance cycle. So what we'll do is we'll go through and like clean it and run a cleaning cycle and everything, and then check the gasket, make sure we're wiping everything out really good. So, all right, that's it. Thanks.